Hey everyone, welcome back to My Lab Health and Wellness. Today we're diving into something you probably experienced or heard about, the pop or crack during a chiropractic adjustment. Well, what's really going on inside your joints when that happens? Is it just a cool sound or is there more to it? I'm Dr. Evan Schwindt. Let's break it down, science style. Cavitation 101. First, let's talk about what's actually happening. That pop isn't your bones rubbing together, thankfully. It's something called a cavitation. Think of the liquid in your joints like a fizzy soda. When we adjust a joint, we're rapidly dropping the pressure inside. This change causes the gas bubbles to form and collapse in the joint fluid, creating that iconic sound. So think about pulling on the finger. Here's a cool fact. At about 8 kilograms of tension on a joint, like your knuckle, this cavitation happens. Create about a 4 millimeter gap. Now that's tiny, but significant inside a joint. And in 2015, for the first time ever, researchers used an MRI to actually see this process in action. It's fascinating. They discovered it's not just bubbles forming, it's tribonucleation, where those bubbles partially collapse, creating the popping sound. So why does this pop matter in chiropractic care? Research shows about 74% of adjustments produce that audible sound. For many patients, that pop feels like proof the adjustment finally worked. In fact, 63% of patients associated the pop with effectiveness. They describe it as a feeling of sensation, but here's the thing, a pop isn't necessary for an effective adjustment. So let's talk about the placebo and nocebo effect. Now, expectation plays a huge role here. If a patient expects a pop but doesn't hear one, it could lead to a nocebo effect, where they feel the treatment wasn't effective, even if it was. That's why we educate patients on what's really happening. The goal of an adjustment isn't the sound, it's improved pain, movement, and function. The fact is, to create cavitation, you need stability in the joint. During an adjustment, the spine anchors the areas above and below, allowing the targeted joint to release. If a joint already has enough movement in one direction, like say C1 up at the top of the neck, which is built to rotate, it may not produce a pop, and that's perfectly fine. Now, direction also matters. So current research also suggests the best results come from adjusting in the direction of restriction or tenderness or both. Interestingly, even adjusting away from a painful area can help. For example, if a patient can tolerate pressure on the site of pain, adjusting the nearby pain-free segment can still be effective. Of course, there are many myths about cavitations from chiropractic adjustments, so let's get into perhaps the top 5 most common ones. Myth number 1. The cracking sound is bones grinding against each other. Truth? Now, the sound is not your bones rubbing and grinding. It's caused by a phenomenon called cavitation, as we discussed, where rapid pressure changes in the joint fluid create and collapse gas bubbles. Your bones are not colliding, I promise. Myth number 2. If there's no pop, the adjustment didn't work. Well, like we talked about, the truth is a pop is not necessary for a successful adjustment. The goal of chiropractic care is improved mobility, reduced pain, and better function, not just the sound. Adjustments without cavitation can still achieve these outcomes. Myth number 3, cracking your joints causes arthritis. I know I heard this one growing up. So decades of research have shown no association between joint cracking and arthritis. Frequent knuckle cracking may lead to temporary hand swelling or reduced grip strength temporary, which mimics similar symptoms to osteoarthritis, but it does not cause osteoarthritis. Myth number 4, the cavitation is dangerous. It can damage your joints. But the truth, cavitation is a normal and harmless byproduct of joint adjustments. When performed by a trained chiropractor, adjustments are safe and designed to improve joint health, not harm it. And myth number 5, the louder the pop, the better the adjustment. Truth, the volume or the presence of the pop has no correlation with the quality or effectiveness of the adjustment. The sound is simply a byproduct of the pressure changing within the joint. Now, how about we discuss maybe the 9 most common FAQs we at MyoLab hear about that wild popping sound from an adjustment. Number 1, what causes the popping sound during an adjustment? As we keep talking about here, the sound is caused by cavitation, where rapid pressure changes in the joint fluid create gas bubbles. When the bubbles collapse, they produce that distinctive pop sound. Number 2, does every adjustment produce a cavitation sound? No, not every adjustment results in a pop. Factors like joint stiffness, the direction of movement, and even individual anatomy play a role. Adjustments without cavitation can still be highly effective. Number 3, is cavitation harmful? No, not at all. Cavitation is a normal process that happens in healthy joints. And when performed by a skilled practitioner, adjustments are safe and beneficial for improving joint function. Number 4, so why do some people experience cavitation more frequently? Why can I do this to myself all the time? Well, frequent popping could be related to factors like tight soft tissues, unique joint biomechanics, or even just posture that creates varying pressure in the joints. These aren't necessarily harmful, but may warrant evaluation if the constant popping causes discomforts. Number 5, can I adjust myself and get the same benefits? While self-cracking may produce a similar sound, it does lack the precision and therapeutic intent of a professional adjustment. Now, inappropriate self-adjustments can sometimes cause joint instability or unnecessary strain over time as you keep adjusting the same joints and other joints actually get tight. Number 6, why do patients associate the pop with effectiveness? Many patients describe the pop as a freeing sensation or as a sign that something has shifted or worked, which aligns with their expectations. While the pop can feel satisfying, the real effectiveness lies in improved joint function and reduced pain. Number 7, can adjustments cause long-term damage to my joints? Well, again, when done by a trained professional, adjustments are designed to improve joint health, not damage it. Long-term issues typically arise only with improper or excessive forces, which is why professional care is essential versus doing yourself. Number 8, why did I hear a pop during my adjustment? Well, it can be factors like muscle tightness, the specific joint being adjusted, or whether the joint has already had sufficient movement, and that can all prevent cavitation. It's not an indicator of a failed adjustment. Lastly, is the cavitation unique to just chiropractic care? No. Cavitation can occur in any joint where pressure changes cause gas bubbles to form and collapse. However, chiropractic care uses specific technique to target restricted joints for therapeutic benefit and thus most commonly related to chiropractic. Now, at the end of the day, the science behind cavitation is fascinating, but the pop is just a byproduct of the real goal, helping you move better and feel better. If you're curious to experience this firsthand or want to learn more about the benefits of chiropractic care, come visit us at MyoLab. We'd love to help you move and feel your best. Thanks for watching and see you in the next one.